Welcome once again to another talk between Domestic Violence Center of Chester County and LCH. We're happy, very happy that you're joining us today. I'm Daphne, caseworker at LCH, and with me is Clara from the Domestic Violence Center. Hello, Clara.
Hi, Daphne. Hi, everybody.
So this month is LGBTQIA plus Pride Month. And in dedication, we want to focus this chat on learning more uh, on how domestic violence impacts this community, create more awareness, and also talk a little bit about the resources available. So, we're going to begin with sharing some stats, both national and local stats. And in 2012, fewer than 5% of LGBTQIA plus survivors of intimate partner violence sought orders of protection. Today it's a little bit better. But not very much. It's up by 7%. So it went from 5% to 7%. Transgender victims are more likely to experience intimate partner violence in public compared to those who do not identify as transgender. And 43.8% of lesbian women and 61% of bisexual women have experienced rape, physical violence, or stalking by an intimate partner at some point in their lives, as opposed to 35% of heterosexual women.
26% of gay men and 37% of bisexual men have experienced rape, physical violence, and stalking by the intimate partner in their lifetime, in comparison to 29% of the heterosexual men. And only 26% of gay men actually call the police for assistance after experiencing the near lethal violence. And it's very true. So in our lethality assessment program, it's very low compared to, counterwise. And the number of LGBTQIA plus, they do identify individuals seeking DVCC services have definitely increased in our office, and we actually see that trend to be, as we had predicted, to go up. And that's due to the awareness that we are doing in our community, as well as there's a lot of work that that this community does, the LGBTQIA plus does in terms of reaching out.
So that's a great thing. That's a good thing. So.
It is. It is. I also want to mention that there was a 2021 study by there's a national LGBTQIA plus Institute of Intrapersonal Violence. And there are several aspects of intimate partner violence which can be unique to this community, which is called the outing, or the threat to reveal one partner's sexual orientation or gender or identity. And this can be used as a tool for the abuse and in violent relationships, as well as a barrier to reduces the likelihood for someone to seek help. On the average, there's at least 22 transgender and gender non-conforming people or victims of fatal violence each year. There's a higher dating and intimate partner violence rates among the LGBTQIA plus youth than in their straight peers. In the Latin LGBTQIA plus, there's additional barriers to this phase in this community, because there's the familiism, which means that it's a family-oriented community. The machismo. There's also the complex of immigration. Hate crimes against the Latin communities have definitely increased. So therefore, in this community, they have higher barriers. And obviously, the danger of outing is when they seek help, there's a risk of rejection and isolation. We also want to emphasize that victims of in the LGBTQIA plus, they need to know the local resources when it comes to domestic violence, because a lot of the times the abusers, they might be getting support from the LGBTQ community services organizations, and such as we will talk about the resources that serve and support this community just for their own services, but they might be getting services through them. So it's a good idea for victims to know that the domestic violence centers, we have confidentiality, and we can only serve victims. We will not serve abusers.
Yes, and what's interesting, Clara, of course, domestic violence among these community members sort of manifests itself a little bit different, right? Different from, say, the heterosexual community.
Yeah,
You mentioned outing. That's a big fear. A partner can threaten to out to family, friends, church members, a landlord, any number of people. They can question their partner's gender identity as well, right?
right,
Question it. That they can also withhold hormones. I had been reading about that, and I was really very surprised, shocked. So they can withhold hormones like testosterone or estrogen. They can refuse something as simple as using their affirming pronouns, or
right.
refuse to use their chosen name.
Yeah, and also they can be also used against when it comes to like in the legal matters such as custody and all those things. Not every community is supportive of this community, the LGBTQIA plus, and sometimes it can become a difficulty when it comes to custody and there's domestic violence.
So, what can we do in our community to reduce or eliminate domestic and family violence towards the LGBTQIA plus community?
Well, there's many things that we can do, and we should be doing already as a community. That we're here to support them. But basically, you can start with the minimum level of you. Um, you can interrupt any type of jokes, comments, bullying, or any language behaviors or actual behaviors with homophobia and transphobia, because not it's not okay. um, it might appear that it's okay, but it should not be okay. Sometimes, there's a common use of words that it could be common to be used amongst people when they're speaking, but if you don't speak up and say, hey, that's not okay to say, that's actually something offensive, then you're by not saying something, you're actually making that an effort that it is okay to say it. And one of the things that I have heard from some of my clients is that we never should assume people's sexuality, orientation, or gender identities. We should never assume. There's a way for us to ask, in a professional, understandable way, to ask, what pronouns would you like us to ask, and ask questions. They love to answer. They as long as that question is asked in a professional,
In
better
a
way.
respectful way, yes, that's right, in a
Yes.
respectful way.
And then
Yes.
obviously the families and friends of LGBTQI plus member can also express their support. We can attend Pride and flag rallies. We can speak to someone about you know that they may have some homophobic phobias and different things. And there's always a way for us to get involved. There's also, if they're victims of abuse, there's also information up there. We can, provide the resources. Victims of abuse in any community, and for the purpose of speaking today, the LGBTQIA plus community, they deserve the right to be safe. They deserve the right to be assisted, and they have rights just like anybody else. One of the things that as an agency as well as a community we should, and community organizations, is that we need to be inclusive and empowering. Ask for and use the preferred pronouns, as I mentioned earlier. You can use the term partner instead of assuming that the individual has a boyfriend or girlfriend, or husband, wife.
Mhm.
Sometimes we use a lot the word significant other, because sometimes
Mm,
it's not,
the-
stuff. We also allow the individuals to define their own sexual orientation. It is not up to us to say, are you a female, gender, all that. We ask those questions. And obviously, being an advocate. You can be an advocate. Every community member can be an advocate.
Yes, and where can they get help?
Well, we have our office, the Domestic Violence Center, Chester County. We're open 24/7. We have our hotlines, and there's also a lot of resources in the internet, where you have resources about your rights, and there's local communities actually that serve the specific community of the LGBTQIA plus, and there's other things that we can do.
Yeah, and just I'm just going to throw that this out there. I know that in the past, Clara, you've spoken about a safety plan for someone who is in a domestic violence situation, and this is no different. So they also should have some kind of a safety plan for themselves,
Yes.
or if you know someone who's experiencing domestic violence within their relationship, maybe this is something that you can bring up and speak to them about, and even maybe even help them create a safety plan, a safety bag, with all important documents and things like that, and assist them by keeping that bag safe for them in the
Yes.
event that they should need it.
Yes, and every safety plan is actually unique to the individual. And so when it comes to somebody that is in the LGBTQI plus community, that safety plan looks completely different, than to the counterpart, because there are other additional things that need to be added in.
Very well. Well, we want to thank everyone for joining us today. We hope that this has been eye-opening. It has been helpful. And remember that we here at LCH and the Domestic Violence Center are here to assist you with any questions, any concerns. So again, please feel free to reach any of us. And again, we want to thank everyone for joining us. Thank you, Clara.
Thank you. And before we actually end, I wanted to also provide you that there is a LGBTQ Equality Alliance of Chester County. They have a plethora of services as well as information. You can Google them through, it's just called LGBTQ Equality Alliance of Chester County. And besides looking for us, you can also text what's called START to 88788, and that is the National Domestic Violence Hotline. And then they can give you resources locally. And then the other one that is something that we use a lot and we partner, the Domestic Violence Center Chester County partners with, is called the Network or La Red. And they are specifically working with victims of domestic violence that are in the LGBTQI plus community. And, we partner a lot with them. There's also a teen line as well as a trans line, lifeline. And obviously, don't forget to call us and we can give you all these resources.
That's fantastic. All good information. Thank you so much.
Thank you, everybody. Have a great one.